our first discussion on the show is about a subject that we've been covering quite a lot with Dr. Bob Gill, which is private healthcare lobbying. And I'm really pleased that we've got someone from the Every Doctor website and Twitter account to speak on the show about their campaign on RRMPs for sale. Dr. Megan Smith is on the call. We've been covering this issue of private healthcare lobbying, but Every Doctor has got such a big following and is building such a reputation for confronting this issue that it's great to see you. Your description on your Twitter is barrister, consultant, anaesthetist, and head of legal. You're pretty much a jack of many trades there.
I am, yeah. Probably master of not quite all of them, but yeah. So I started out when I left school and did my A-levels. I went and studied law and practiced as a barrister for a few years, and then had a bit of a change. Went to med school. And I've practiced as a doctor since 2003. But when I got involved with Every Doctor, which was about 3.5-4 years ago now, we realised that there was a definite sort of role for an in-house lawyer, as well as all the other sort of policy stuff that I do. So I resurrected my practicing certificate, and so now I wear both hats, or one hat and one wig. So yeah, it's an interesting and varied life. It's great. I'm very lucky.
Now, obviously, you're not partisan. You're not targeting any particular political party. You identify, as you see in that poster before, you've got Lib Dem and a Tory and a Labour.
Yeah, absolutely.
MP. The Labour MP that you had in that poster is Wes Streeting, and I'm just showing this tweet that you've got from a few days ago. Wes Streeting's financial links to the private healthcare sector since the last general election wouldn't fit into one screenshot, so we've popped them all below. Please retweet this thread. Right, so these are what's below. Right, so there's one here, Peter Hearn, 22,500. MPM, Trevor Chin, 7,500. MPM Connect, 45,900. John Armitage, 15,000. Trevor Chin, 7,500. And there's one more, even John Armitage, 15, and right, it's just 8. And MPM Connect, another one of 80,000. Now the question is, that's a lot of money that he's getting from private healthcare, but surely you can't say that corrupts him. He's just using that for his office, isn't he?
Yeah, I mean, we're not in any way saying that these MPs are being bribed or doing anything wrong. We feel that there should be no link between those who make decisions about NHS funding and the deployment of resources, as he's hoping to be able to do sort of this time next year. There shouldn't be a link between them and people who stand to benefit from a non-publicly funded for-profit NHS. And I think it's easy. I mean, I don't know if my dad's watching, but my dad's a proper Labour lefty, and so we've had discussions about this, which is so what's the problem then? What is the problem? Why is it a problem for them to take the money? And so I've really thought hard about that, and we as an organisation have thought hard about it and done some research as well. And I think there are a number of issues here. One is that so doctors, for example, have not been allowed to sort of take or sort of donations or kind of gifts or hospitality or anything like that from the pharmaceutical industry for quite some time now. And it's interesting because there was a study done back in about 2014 that looked at doctors who said, my professional integrity means that I would never be influenced, even if I took one of these things, which were often skiing holidays or something like that. I would never be influenced. I practice evidence-based medicine, and so it would never affect me. And the study showed that even those who said that were influenced by a drug rep or a pharmaceutical representative coming to their surgery or to their department. Advertising, marketing, those sorts of things, they're subtle and they're clever, and we all think that we're impervious to them, but we're not. So I think even without these MPs knowing, they could easily be influenced. So I think that's point number one. Point number two is that there's a really good study from Oxford University, their Department of Economics, back in, I think it was about 2015-16, that looked at whether there was a link between being a big donor to a political party and being given a peerage. And they said, look, lots of investigative journalists have done great work on this, and there are individual cases and scandals going back from the mid-1990s, from Cash for Questions to Cash for Access to Cash for peerages, that has affected all of the three main parties. Everyone has been affected and guilty of those things. But can we conduct some sort of statistical analysis and say, well, is it likely? And they did this. And what they concluded was that the chance of it being a coincidence that someone was a big donor and got a peerage, the chance of that being a coincidence was about as likely as someone winning the national lottery jackpot 5 weeks in a row. So theoretically possible, exceptionally unlikely. So that's number two. And the third one is that there's a really good Transparency International report, I think a fabulous organisation looking at sort of global corruption, focusing on individual countries as well. And they published a report in 2016 about political donors, political donations. And some of the data from that shows that, and this was before Boris Johnson walked through the doors of Number 10, that the public trust in politicians and politics is terrible. You know, nearly 80% of those in the UK who were asked thought that politicians would be influenced by money, that they would exert influence on behalf of a wealthy donor. Nearly 30% thought that prime ministers were affected by donors and would make decisions for them. So some of the MPs who are featured on the map, a few of them have been in touch and aren't happy about it. Most of them have dealt with it privately, one hasn't. But one of the things I said to one of them was that the appearance of rectitude is arguably as important as actual rectitude for the public. And so for those reasons, I think that's why it's really important. We're not saying they're dodgy, they're dishonest, they're corrupt, but it's easy to be influenced and not realize that you're being influenced. Yeah. But the public don't trust you. The public don't trust you if you're taking this money, and you shouldn't be taking it. That's our stance.
Well, I mean, that you kind of mentioned in a way what maybe you were alluding to this exchange with Stella Creasy, which I've picked up on, because I think it shows.
You heard about that, did you?
it did make a lot of a noise on social media, especially. Yeah. Now I'll just show the first tweet. It says, "Why did Stella Creasy MP earn money from the insurance company? Major private health insurance business in the UK. If you think this is wrong, please sign here." Yeah. I noticed that then she responded to complain that this money was actually a donation to a charity, that she gave it to a charity, and wanted you to delete the tweet and stuff like that. Yeah. But you didn't. No, and you had a very good reason for saying that you wouldn't do that. Can you explain what that was?
Yeah. I mean, we talked about it as a team. We take it really seriously. So first of all, we just double checked accuracy, because plowing through all of that data, you know, it's been thousands of pages of the Register of Members' Interests, and I'm the one who went through it. I'm not fallible, and so we wanted to double check, and we were right that she did take a donation from Aviva, which is a massive public private healthcare insurer in the UK. And she says in her entry that it was paid direct to charity. For us, it's not really the destination of the money that's relevant here, it's the source of the money. And we completely accepted and very quickly publicly said, we totally accept that you gave it to charity. And then she pointed out that it didn't even go through her hands, it went directly to charity. We're happy to accept that as well. That for us is not the point. The point is where it came from, not where it's gone to. And the reason that it matters where it's come from is for the reasons that we were discussing earlier about influence and perception as well, that potential for influence and perception. And I suppose my question would be, well, 2 points. One is, so why is Aviva doing this? Aviva it's a big insurance company. It does cars and homes and all kinds of things, but it does a lot of private healthcare insurance. It turned over 102 million in Q1, so the first quarter of this year, 102 million pounds in private healthcare insurance. That was an 11% increase on last year. And if you look at their sort of accounts part of their website and their news update, they're very happy about this, and they're projecting a bigger increase next year. What that means is the NHS is likely to become more and more privatised, and they will profit from it. So why are they doing it? They're probably not doing it out of the goodness of their heart. It's probably not through altruism. They are hoping at some point further down the line to be able to exert some influence. And that may not be directly, we'll vote this way, but there are all sorts of subtle ways of influencing politicians and people. One of the other things that were sort of thrown back at us by a couple of MPs was, basically, I'm one of the good guys. Look at my voting record. I've never voted for anything to do with NHS privatisation. I've always opposed it. And one of the points that I made back to a staffer for one of these MPs was, with respect, that's a little bit naive, because it's pretty unusual for an MP to be quite so blatant as to vote a particular way in the House of Commons. It has been done before by a Tory. I think it was Patrick Mercer back in about 2013. He did. But otherwise, they don't do that. They exert influence in a much more subtle behind the scenes way, because they know they'll be caught. They're not that stupid. So I'm not saying she would have done, but that's part of the problem. The second point for me, and this is kind of the lawyer part of my brain that does this, as lawyers, we extrapolate and we sort of analogize. And so my question is, well, if this is okay, then what else is okay? So for example, or as a question, I guess, to Stella Creasy, which company would she say a donation from them isn't kind of cleansed by it being given to charity? How terrible a company could it be before you say, that's my line in the sand and I would never do that? So I don't know, a company that has massive contracts with a government that abuses human rights, a company that uses kids in sweatshops in Bangladesh, a company that destroys the Amazonian rainforest for beef farming. I don't know. We all know of those companies. So I suspect Stella Creasy would say, I would never take any money from them, even if I was giving it to charity. Those would be her lines in this. I'm not saying they are. I don't know her at all. I've never met her or talked to her. But she will have some lines in the sand. So all we're saying as an vehemently anti-NHS privatisation organisation is that's our line in the sand, is that you as an MP should not be taking money from an organisation like this, and the fact that you gave it to charity does not cleanse that money in our minds. You can disagree. It's the beauty of free speech and a democracy, and she clearly disagreed. That's fine, but that's why we didn't take it down. That's a long-winded lawyer's way of saying that's why we didn't take it down.
I really appreciate your explaining it, because it makes perfect sense to me. And also the sort of privatisation of the NHS has been done on a very gradual, almost invisible way. Yeah. So to actually set a boundary that's clear is what we need now, don't we? We don't need sort of like to say, well, maybe that's okay, maybe that isn't, because it needs to be a strong message, doesn't it?
I think so. And I think I individually and we as an organisation think that it needs to be a strong and clear message, that it's easy to do stuff by stealth if it isn't a strong and clear message. And that actually, it's what the public wants. If you look back to the most recent polls, which are still sort of 2018, 2019, the public is 84% and 82% in favour of a publicly funded, publicly provided, not-for-profit NHS. There is no mandate for NHS privatisation, and existing politicians know it. And that's why they don't campaign on the basis that they want to provide it, that they want to do it, because it's a vote loser. And I think that and we as an organisation think that is fundamentally dishonest. At least have the bravery to go out there and say, no, we're privatising, vote for us, we're privatising it. But they don't do that. And unfortunately, Labour in its current iteration is doing the same. And that's really disappointing. I mean, they've changed tack. Keir Starmer's changed tack, and then the party has changed tack. Initially from his Labour leadership election promises, and then subsequently to move from, we won't be outsourcing to the private sector, to, oh, well, COVID, Brexit, maybe we have to outsource to the private sector, to, pretty much fully engaged in outsourcing to the private sector. And as doctors, we all know that that's a terrible, terrible idea. It's bad for patients. It fragments the service. And actually what all of these politicians fail to realise, and maybe it's just because they're not doctors, is that at the centre of all of this is a patient. It's a person and their family. And what you don't want is competition in care. You don't need competition in care. What is absolutely fundamental to good patient care is collaboration and consultation between teams. Inside a hospital, we don't have a bun fight about whose patient this is or who should really be taking over. We don't, well, actually probably more it's trying to fend off and say, no, this is much more a cardiology problem than a this problem. But it's about, we pick up the phone and we talk to colleagues and we say, look, this is a complicated multi kind of physiology system issue, and we need lots of people involved. We need to collaborate, and that needs to be true for the whole system as well. And there'll be people on this call who've had a nightmare with well, the GP is here, but then I've got to go and get a physio appointment over here, and then I've got to do this, and that's done by a private company, and then I've got to go into some big lorry somewhere that's a private MRI scanner in a car park in order to... It doesn't make sense. It should all be under one roof, and in our view, it should all be publicly funded. And the fact that it isn't is a political decision. It's not a financial decision. That's another kind of myth, I think.
Well, look, I'm just wondering. I mean, I think you should. People are saying you've got to come on again. So I'm just wondering if you could show the link. How's it going with the website? How many followers? Are you getting lots of traction on that?
Well, it was kind of interesting this week because obviously the Stella Creasy stuff did sort of blow up a bit, and we had a moment where we thought, oh crikey, have we really misjudged this? Well, we're sticking to our guns, and if we lose followers, if we lose support, then that's okay. But we stick to our guns because this is a really key principle for us. But we haven't lost any followers, and on Twitter we gained a few hundred followers. Our mailing list has grown by about 2,000 people this week. So, and there's a lot of traffic through the website, and more and more. I think probably we've sort of really pushed it in the last sort of week to 10 days, so we might give a little bit of a break to people because they're probably a bit overwhelmed by the number of MPs who are quite happy to take the private healthcare sector's money. Although that said, I have to say I'm encouraged by the fact that it's probably about 10% of MPs, maybe slightly more than 10% of MPs who are taking money from that sector. One of the real eye-openers as I went through nearly 4 years worth of the register of members' interests was all of the other interests, all of the other people who are donating and what they represent. And just as an aside, the gambling industry is a massive one, donating across the board, but mainly to the Conservatives. And the impact of that on public health is already a bit of a crisis. That's going to be one of the big public health crises, addiction to gambling, in the next sort of 5 to 10 years. So it's disappointing, and I think we have to get rid of it.